Imagine you get a small cut on your finger. Almost immediately, without you even thinking about it, your body springs into action. This incredible process is called hemostasis. It is the body's natural, built-in emergency response system designed to stop you from bleeding. Think of it as your own personal team of paramedics, always on standby to patch up any leaks in your circulatory system. This system is remarkably efficient. It works quickly to prevent significant blood loss from minor injuries, protecting you every single day from countless small nicks and scrapes that could otherwise become a big problem. Without it, even a paper cut could be a serious medical event. The first thing that happens when a blood vessel is damaged is that it constricts. This is known as vasoconstriction. The muscle in the vessel wall tightens up, narrowing the opening and reducing the flow of blood to the injured area. It's a simple but brilliant first step, like pinching a leaking hose to slow the flow of water. This immediate reaction buys precious time for the next stages of the clotting process to begin. It's a purely mechanical response, an automatic reflex that happens in a fraction of a second, demonstrating the body's incredible ability to protect itself from harm before you are even consciously aware of the injury itself. Next, tiny cell fragments in your blood, called platelets, rush to the scene. These platelets are sticky. When they encounter the rough, damaged edges of the blood vessel, they change shape and start clumping together. They form a temporary plug, a sort of makeshift patch over the hole. This is called a platelet plug, and it's the second crucial step in stopping the bleed. This initial plug is soft and not very strong, but it's effective enough to temporarily halt the bleeding, especially in smaller vessels. It's the foundation upon which a more permanent solution will be built, a rapid response that sets the stage for a stronger repair. Finally, the body initiates what is known as the coagulation cascade. This is a complex chain reaction involving a series of proteins in your blood called clotting factors. These factors activate one another in a domino-like effect, leading to the creation of a tough, fibrous protein called fibrin. Fibrin strands weave themselves throughout the platelet plug, creating a strong, stable mesh. This mesh traps more platelets and red blood cells, forming a solid, durable clot that seals the wound completely. This final clot is much tougher than the initial platelet plug and will stay in place until the vessel wall has had time to heal itself properly. The process of hemostasis is all about balance. Your body needs to be able to form clots quickly and effectively to stop you from bleeding to death from an injury. However, it also needs to make sure that these clots don't form when they aren't needed. Unnecessary clots can be incredibly dangerous, blocking blood flow to vital organs like your heart, lungs, or brain. This is why the body has a parallel system, known as fibrinolysis, which works to break down clots once they are no longer required. It's a constant, delicate balancing act, a biological tug-of-war between stopping leaks and keeping the pipes clear. This balance is absolutely critical for your health. If your clotting system is too weak, you might suffer from excessive bleeding. This condition, known as a bleeding disorder, means that even minor injuries can lead to significant blood loss. On the other hand, if your clotting system is too aggressive, you are at risk of thrombosis. This is where clots form inside your blood vessels without any injury, obstructing the normal flow of blood. Both extremes are dangerous and can lead to life-threatening complications. The body, therefore, has numerous checks and balances to keep this system finely tuned, ensuring it responds only when and where it's needed. Think of it like driving a car. You need a powerful accelerator or pro-clotting factors to get moving when you need to, but you also need effective brakes or anti-clotting factors to stop you from crashing. The body uses a variety of signals to control this process. When a vessel is damaged, signals are released that kickstart the clotting cascade. Conversely, healthy, undamaged blood vessel walls release chemicals that actively prevent platelets from sticking and clots from forming. This sophisticated communication system ensures that clots are localized to the site of injury and don't spread throughout your circulatory system, maintaining that crucial equilibrium. Ultimately, this equilibrium is what allows our circulatory system to function. It allows blood to flow freely, delivering oxygen and nutrients to every cell in your body, while also having a robust repair mechanism ready to deploy at a moment's notice. When this balance is maintained, we are protected from both uncontrolled bleeding and dangerous blockages. It is an underappreciated marvel of human physiology, working silently in the background every second of every day. Understanding this balance is the first step in understanding what goes wrong when blood disorders arise, leading to either too much bleeding or too much clotting. Sometimes the body's clotting mechanism doesn't work as it should. This is known as impaired hemostasis, and it leads to an increased risk of bleeding. One of the most important organs for blood clotting is the liver. Your liver is a factory for many essential substances, including most of the clotting factors, the proteins needed for the coagulation cascade to work. If the liver is damaged by conditions like cirrhosis, hepatitis, or chronic alcohol abuse, it cannot produce enough of these vital proteins. As a result, the entire clotting process is weakened, and the body struggles to form stable clots to stop bleeding. A person with severe liver disease might bruise very easily or experience prolonged bleeding from minor cuts. They may also suffer from internal bleeding, which can be much more dangerous as it is not immediately visible. Simple procedures like having a tooth pulled can become risky events. This is because the coagulation cascade lacks the necessary components to build a strong fibrin mesh. The body's emergency repair kit is missing its most important tools. Doctors must be extremely careful when performing surgery or other invasive procedures on patients with liver disease, as the risk of uncontrolled bleeding is significantly higher than in a healthy individual. Another crucial component for clotting is vitamin K. This vitamin is essential for the liver to properly synthesize several key clotting factors. Without enough vitamin K, the liver might produce the clotting factor proteins, but they are defective and cannot function correctly in the coagulation cascade. A vitamin K deficiency can occur for several reasons. Newborn babies, for example, are born with very low levels, which is why they are routinely given a vitamin K shot at birth. In adults, it can be caused by poor diet, certain medical conditions that affect nutrient absorption, or long-term use of antibiotics, which can disrupt gut bacteria that produce vitamin K. Just like in liver disease, a lack of vitamin K leads to a bleeding tendency. The symptoms are similar: easy bruising, nosebleeds, bleeding gums, and in severe cases, dangerous internal bleeding. The good news is that a vitamin K deficiency is often treatable with supplements, either taken orally or by injection. This highlights the intricate connection between our diet, our organs, and our body's most fundamental protective systems. It shows that for the complex machinery of hemostasis to work, all the individual parts, from large organs like the liver to micronutrients like vitamins, must be present and functioning correctly. One of the most complex and dangerous disorders of hemostasis is disseminated intravascular coagulation, or DIC. The name itself sounds complicated, but it describes a truly paradoxical and life-threatening situation. In DIC, the clotting process, which is normally localized to a site of injury, becomes activated throughout the entire body in a widespread, uncontrolled manner. This massive, systemic activation is usually triggered by a major underlying condition, such as severe infection, like sepsis, major trauma, cancer, or complications from childbirth. It is not a disease in itself, but rather a catastrophic response to another serious problem. This widespread clotting uses up the body's supply of platelets and clotting factors at an alarming rate. Tiny blood clots, known as microthrombi, form in small blood vessels all over the body. These small clots can block blood flow to vital organs like the kidneys, lungs, and brain, leading to organ damage and sometimes even failure. So the first part of the problem in DIC is excessive, widespread clotting where it really shouldn't be happening. It's as if the body's entire emergency response system has been triggered at once, creating chaos within the circulatory system instead of a targeted repair. Here is where the paradox comes in. While the body is busy forming thousands of tiny, unnecessary clots, it is also rapidly depleting its entire stock of platelets and clotting factors. It essentially uses up all the raw materials needed for hemostasis. So when the patient actually needs to form a clot, for instance at an IV site or an area of internal injury, they can't. The clotting system has been exhausted. This leads to the second and equally dangerous part of the problem: severe, uncontrollable bleeding. It is a devastating combination of clotting and bleeding happening at the same time. A patient with DIC can therefore present with symptoms of both thrombosis, like organ damage from blocked vessels, and severe hemorrhage, like bleeding from mucous membranes, surgical wounds, and IV lines. This makes it an incredibly challenging condition to manage. Doctors are faced with a terrible dilemma. Giving anticoagulants to stop the clotting could worsen the bleeding, while giving clotting factors to stop the bleeding could fuel the clotting. Treatment focuses on urgently addressing the underlying cause, like treating the sepsis with antibiotics, while trying to support the patient's failing circulatory system. DIC is a stark example of what happens when the body's delicate balance of hemostasis is completely shattered. While DIC involves clots forming everywhere, a more common problem is when a single, unwanted clot forms within a blood vessel. This is called a thrombus, and the condition is known as thrombosis. These clots typically form in veins, especially the deep veins of the legs, a condition known as deep vein thrombosis, or DVT. A DVT can cause pain, swelling, and redness in the affected leg, but the real danger emerges when the clot, or a piece of it, breaks free. This is when the clot goes rogue, turning from a local problem into a potentially deadly missile traveling through your bloodstream. When a thrombus breaks off from its original location and travels through the circulatory system, it is called an embolus. This traveling clot will continue to move through the bloodstream until it reaches a vessel that is too narrow for it to pass through. When it gets stuck, it blocks the vessel, cutting off blood supply to whatever tissue or organ lies beyond it. The consequences of this blockage, known as an embolism, depend entirely on where the embolus lodges. It is a medical emergency that requires immediate attention, as the lack of blood flow can quickly cause irreversible tissue damage. If a clot from a DVT in the leg travels, it will move up through the veins, pass through the heart, and then get pumped into the pulmonary arteries, which lead to the lungs. If it gets stuck there, it causes a pulmonary embolism, or PE. A PE is extremely dangerous because it can block blood flow to a large section of the lung, preventing the blood from getting oxygenated. Symptoms include sudden shortness of breath, sharp chest pain, and coughing up blood. A large PE can be fatal, as it can cause the heart to fail from the strain of trying to pump blood against the blockage. While clots from veins usually travel to the lungs, clots that form in the heart or arteries, often due to an irregular heartbeat like atrial fibrillation, can travel elsewhere. If an embolus travels to the brain, it can block a cerebral artery and cause an ischemic stroke, leading to brain damage, disability, or death. If it lodges in an artery supplying the heart muscle itself, it can cause a heart attack. This is why preventing unwanted clot formation and recognizing the signs of a traveling clot is so crucial in modern medicine. It's a silent danger that can strike with devastating speed and consequence. So, why do these dangerous clots form in the first place? In the 19th century, a German physician named Rudolf Virchow identified three main factors that contribute to the formation of a thrombus. This framework, now known as the Virchow triad, is still used by doctors today to understand and assess a patient's risk for thrombosis. The three components are injury to the blood vessel wall, abnormalities in blood flow, and changes in the blood's composition that make it more likely to clot. Usually it takes a combination of these factors to trigger the formation of an unwanted clot. The first factor is injury or damage to the inner lining of the blood vessel called the endothelium. In a healthy vessel, this lining is incredibly smooth, which helps prevent anything from sticking to it. However, it can be damaged by many things, such as surgery, major trauma from an accident, or inflammation from an infection. Even the insertion of an intravenous catheter can cause enough irritation to injure the vessel wall. When the endothelium is damaged, it exposes the underlying tissue, which signals to platelets and the clotting system that an injury has occurred, kicking off the coagulation cascade just as it would for an external cut. The second part of the triad is abnormal blood flow. Blood is meant to flow smoothly and quickly through our vessels. When blood flow becomes slow or turbulent, problems can arise. This is often referred to as stasis. A common cause of stasis is prolonged immobility, such as being bedridden after surgery or sitting for a long time on a plane or car journey. When you aren't moving, the muscles in your legs aren't contracting to help pump blood back to the heart. This allows blood to pool in the deep veins of the legs, increasing the chances that clotting factors will accumulate and platelets will stick together, initiating a clot. The final factor is hypercoagulability, which simply means the blood itself is more prone to clotting than normal. This can be caused by a wide range of conditions. Some people inherit genetic disorders that affect their anti-clotting proteins, leaving them with a lifelong increased risk. Other causes are acquired, such as cancer, which can release pro-clotting substances into the blood. Pregnancy also makes the blood more coagulable as a natural way to protect against blood loss during childbirth. Certain medications, like some forms of hormone replacement therapy or birth control pills, can also increase the tendency of the blood to clot, tipping the balance in favor of thrombosis.